Hello, I'm Dr. Diana Bitner, co-founder and CMO of True Women's Health. Welcome to our Let's Chat about heart disease. It is Go Red Month, and we're going to talk about heart disease tonight. A little bit of housekeeping before we get started. On February 24th, I am so honored to have a guest with me, Vonnie Woodrick. She is the author of the book, I Understand. Vonnie is a life coach and unfortunately has personal experience with family members with depression and suicide. So she's wrote this wonderful book, and she really wants to change the conversation around mental health. And so we're going to do a Let's Chat on mental health matters. And again, I'm so honored that Vonnie will join us directly, and she'll be able to talk about her organization, I Understand, and her book. So please set your calendar for that. So tonight we're going to talk about heart disease. And why do I care about this? I first like to talk about this to set the stage. I care about this because heart disease is preventable. Every day I ask women, what do you want? They never say, oh, I think maybe I want a heart attack at 61 instead of 58. No, women say, I want to be fit. I want to be strong. I want to be healthy. I want to do what I want to do as long as I want to do it, when I want to do it. That's what women want. And actually, I had a woman the other day who said, I want all my body parts to keep up with me and not have some of them have to catch up from behind. And I want to be ready to go and do what I want without any limitations. That's what women want. They don't want heart disease. And I was driving home from work tonight to join you, and I was thinking about all the women driving in their cars and not knowing what their risk is, not knowing that they can prevent this. And heart disease will kill 1 in 3 women. It's ridiculous. It doesn't have to happen. So we have a lot to get to tonight. So let's get started. How I like to think about it is that heart disease is silent until it's not. What does that mean? Women, by the time they have chest pain, by the time they have shortness of breath, to the point they can't catch their breath, they can't walk up the stairs, they can't exert themselves without an issue, and they go to the ER, it's not too late. It's just that we can't turn the clock back. Now it's all about heart disease, and heaven forbid she's having a heart attack. But we know that by the time she has symptoms, she already has blockage in the blood vessels around her heart. She probably has blockage in the carotid artery or in the arteries that lead to the brain. And unfortunately, she might already have plaque in those small little blood vessels that get blood to our brain cells and allow us to think and prevent dementia. So again, heart disease is silent in many women until it's not, unless you take a deeper dive. So that's where we love really understanding about risks of heart disease. And one of the signs that is with us is belly fat. And belly fat is not something any of us like to talk about. At True, we like to we measure your waist circumference every time you come in. So that feels like such a personal thing, but belly fat is the Siberia of fat deposits. Once it's there, it does not want to come out. And belly fat is very selfish. Belly fat makes you crave sugar. And when you eat sugar or drink wine or other alcohol, your belly fat, she pulls that sugar right out of your blood right into her. And so belly fat, once it gets going, it gets really powerful. And again, once it pulls in the sugar and the calories into that belly fat, it is so hard to ever get that fat out. And unfortunately, one thing that we connect with, what's another sign of maybe developing heart disease? Chin hair. Chin hair. People, that's the last thing women want is chin hair. But it goes together with belly fat. It has to do with insulin resistance. It has to do with when we gain fat in the belly, we store our pro-hormones in that belly fat. And those pro-hormones can get converted to estrone, testosterone, and androstenedione. And these hormones then turn on those hair follicles and get chin hair started. So again, belly fat is one of those signs that women don't think of. They think of as it's annoying. I can't get rid of it. I can't fit in my regular clothes. But I also look at it as that is a sign of heart disease. And it's so important to look at that as a risk factor. And as we can get rid of the belly fat, then we also reduce risk of heart disease. So let's talk a little bit more about belly fat. So belly fat number one, drives insulin resistance. So again, it makes your body crave sugar and it makes it store sugar. Insulin resistance is much higher in someone, for example, who has a history of gestational diabetes or diabetes in pregnancy or a family history of diabetes. So knowing if a woman is insulin resistant is really important. Another thing about belly fat, especially in late perimenopause or menopause, is that belly fat helps increase your liver's need, or it increases the fact that your liver makes CRP. CRP is one of the inflammatory factors. And how I think about it is that CRP pokes little holes in blood vessels and makes the blood vessel lining sticky. So it allows the fat to stick. So, for example, we know there was a very elegant study done in women undergoing bariatric surgery. So, women are having bariatric surgery, and the researchers sampled the belly fat, the fat deep inside, and they compared it for women who are premenopause or postmenopause. And what they showed is that the belly fat in women postmenopause actually changed their behavior. The belly fat cells made way more CRP and IL-6, these are two common inflammatory markers, than women with estrogen. So women without estrogen, their belly fat changed behavior and actually created more of these inflammatory markers that damaged the lining of the blood vessels. And again, there's so much we're learning about what is called the endothelium. The endothelium are the cells that line all of our blood vessels. And we want that endothelium to be shiny and smooth and slippery, just like the inside of our mouth. And if that endothelium is healthy and smooth, then sugar can't stick, then fat can't stick. And so for example, an important part of heart disease prevention is to not smoke. Why? One of the many reasons is because the stuff in cigarette smoke actually helps damage the blood vessel. And so again, it allows that plaque to stick. And once that plaque sticks, it burrows inside the wall of the blood vessel and makes a plaque and makes that blood vessel get thicker and gets it blocked. And so again, the sooner we know about this in a woman, the earlier we can make suggestions. She can make choices to make sure that she is how she wants to be at 61. And again, not in the ER on a stretcher with chest pain. That does not match a life of infinite possibilities. Shout out to Simon Sinek. But it is all about, if you want to live the life that you want to live, it is about very early prevention. And so, I think prevention gets a bad rap because people don't know what to do. And, it's easy to think about, I'm hungry tonight. It's not easy to think about what am I going to do today that prevents a heart attack later. Family history matters. It's so important to know your family history, especially if someone in your family, especially a first degree relative, your mom, your dad, your sister, your brother, has had a heart attack or a heart event or a stroke less than the age of 60. And what that could mean for you is that you have a risk of premature development of plaque in your blood vessels. Again, blood vessels around your heart, blood vessels in your neck, or blood vessels up in your brain. And so if you have a higher risk of development of early plaque, we need to know that so we can look for it even sooner than a traditional medical model would have you do. Family history also matters, again, in terms of your risk of diabetes. So diabetes can be silent, again, until it's not. So we don't wait until you're thirsty or you're drinking way too much water or, a random blood sugar pops up as high. We want to know way early in, let's say, pre-diabetes, so we can prevent the risk of diabetes and therefore prevent the risk of heart disease. So if you know that your grandma, your aunt, your dad had diabetes and all of the older relatives developed diabetes as they got older, we need to know that. Because again, the sooner we know that, it can give you power over your health. The other thing that's so interesting is that as women develop pre-diabetes, that's what makes the belly fat happen. And so it's not just about getting your numbers down, it's about getting rid of belly fat. And again, it's using those signs that we see. And so I like to think about belly fat almost as a gift. I know it's not a gift once you have it, but it's a gift if you know you have it. It can be a gift that can empower us to make those choices that sometimes are not the easiest choices to make, to exercise after a long day at the office, to avoid that second glass of wine, to avoid that second, treat, or you'd avoid that treat at all, because as you do, the belly fat gets smaller, and again, we lower your risk of heart disease. It is possible to calculate your risk of heart disease. So that brings me to the subject of gender specific medicine. So as women develop heart disease different than men. And years ago at a medical meeting, I was fascinated by the story behind the Reynolds score. So the Reynolds score is a score that is gender specific. It's much more specific for women than men to predict the risk of heart disease. So these researchers took a whole bunch of people that have been stratified to figure out if they have a high risk for heart disease, a medium risk, or a low risk. And when you run women through the Framingham heart risk score, a lot of women are in that moderate category. So we really don't know how aggressive do we be with medication or with advice. And so they added a couple other factors, including a CRP level that we can draw in your blood, and they also included family history. And so if we can look at your blood pressure, your cholesterol, your family history, and your CRP, it gives us a better idea. And so a lot of women in that moderate category sorted out to be either very high risk, so let's get much more aggressive, and or low risk, we can leave you alone. So it's all about knowing what we can do. And so many women are like, well, I don't know my risk. Can you figure out my risk? I think about, what sells those magazines, Cosmo. It's like, what kind of lover am I? What kind of friend am I? What kind of, like us girls, we love to take quizzes. And so I really like to take advantage of that desire that we have to know ourselves in saying, do you know your risk for heart disease? And again, it's Go Red month, right? So we're all talking about heart disease, but why then are heart disease risk factors climbing? I really believe it's because in health, in women's health, we have to make it personal. So again, we have to bring it back to, what do you want? How do you want to live your life at 60, at 70, at 80, at 90? I don't know about you, but I want to be active and fit. And again, do what I want to do as long as I want to do it, when I want to do it, where I want to do it. I don't want to have a limitation of worried I'm not going to go hiking in the Yellowstone because I might have a heart attack. I don't want to have to worry about that. So I'm going to make choices now. I'm going to know my risk for heart disease. And believe me, I know everything I can know about my heart right now. I've had a stress test. I've had some other testing. I'm adopted, so I don't know my family history. So I was a little bit more aggressive. And so I really feel comfortable about what I know. And it encourages me even more to work harder to help myself not have to worry about that. So again, we can calculate your risk for heart disease. There's another score we'll use too called the ASCVD. So it's a score that the American Heart Association talked about. So especially if you see us at True, we will use both those scores to calculate your risk for heart disease. There are lots of tricks. So I have a lot of women who come to me and say, okay, I've had this belly fat forever, and nothing ever has seemed to work. And an example I'll say is that when I first started in practice years ago, women would say to me, I gained 30 pounds and I don't know how I did, and it all went in my belly. So internally, I would kind of roll my eyes and I would think, yeah, how can you not know how you gained 30 pounds, right? You just must have eaten too much. I know now it's way more than calories in, calories out. It has to do with your metabolism, your muscle mass. And for those women who gained that 30 pounds and didn't know how it happened, the first 10 pounds, they knew how that happened. Either they went on a long vacation, or unfortunately they sprained their ankle and they couldn't work out for 2 weeks, or they were taking care of a sick parent and they were really limited on their exercise and they were eating hospital food. So we know that that first 10 pounds makes sense. But after that, that belly fat makes the liver makes the body more insulin resistant. And so then the rest of that next 20 pounds just can come right on and seemingly out of nowhere. So again, it's looking at what happened first, and then that next 20 pounds, that's the Siberia of belly fat. That's where it comes on and it's really hard to get rid of. So what are the tricks? Number one, it's to know all the information we just talked about, but it's to think about those daily habits. So number one, it's to add complex carbs to your diet. For so many women, that sounds counterintuitive. Carbs are bad, right? Not all carbs are bad. So complex carbohydrates are those carbohydrates that have color. So let's say brown rice, complex, sweet potato, complex carb. Oatmeal, complex carb. Now, some oatmeal comes in the packets with all the sugar in it. That doesn't count. I'm talking about the real stuff, oatmeal. So butternut squash, it's a really good complex carb. It's a vegetable with fiber. So there's lists, we give our patients at True lists of complex carbs. My favorite book about this concept is called Sugar Busters. Sugar Busters has a cookbook, it has a book. It's been around for a long time. It was written by endocrinologists to explain the glycemic index of foods. So adding complex carbs to your diet keeps your blood sugar nice and stable. So at breakfast, I want you to have a complex carb. At snack, at lunch, at snack, complex carb. The big trick after menopause is no carbs after 4 most days. So last Friday night, I really wanted some pizza. I had a cauliflower crust pizza. I had a half a glass of red wine. I was good to go. So it doesn't mean every night we can't have a carb after 4, but most nights I avoid carbs after 4, and it just really makes a difference. Why? It's not all about total carbs. It's about toward the end of the day, we tend to be tired. We might be a little bit more stressed. There tends to be a more insulin response. So we release more insulin toward the end of the day, and that can promote fat storage into our belly fat. So again, that trick, it's all about adding complex carbs to your diet and keeping your blood sugar stable all day. Another trick is to avoid simple carbs. So simple carbs are those carbs that are white. So white table sugar, white rice, white potatoes. They have a glycemic index almost equal to that of table sugar. So eating a white potato, there's some benefit. There's some vitamin C in a white potato. They taste really good, right? But it's all sugar. So when you eat a potato chip or when you eat a white potato fry or mashed potatoes, what happens is they go straight to your belly fat. So you're not feeding you're feeding your belly fat. And people will say, oh my God, I just crave carbs. I'm like, okay, not really. You don't crave carbs. Your belly fat crave carbs. So stop feeding your fat. So that's trick number 2, limit simple carbs. So at True, we talk about you get one treat a day. Is that a half a glass of wine? Is that white rice sushi? What is that? But that's your one treat. And I would recommend maybe the earlier in the day, the better. So it's important thinking about that. Other tips are you've got to get sleep. I'll see women and they're doing really well. They're eating well, they're exercising, they're moving, they're really doing a good job with everything except they're not sleeping. And they'll say, well, I'm too busy. I can't sleep. I stay up till midnight and I get up at 5 and I go again. And I'll say, well, choices and consequences. If you don't sleep, you will not lose weight. When your body is in such a stress response of sleep deprivation and it's just trying to keep everything together, you're going to get more of an insulin response and it makes you crave sugar. And where does the sugar go? Belly fat. And then what happens? Chin hair. So again, those are the results of that happening. We can even take really healthy 24-year-old men. A good study was done, and if men are sleep deprived for 4 days, we don't let them sleep for 4 days, their markers of insulin resistance go up, and then they crave sugar. You take them after 4 days of no sleep, put them in a room with either healthy eggs and whole wheat toast or donuts. What are they going to go for? The donuts. So if you don't sleep, you're going to crave donuts. And if you eat donuts, where are they going to go? Straight to belly fat. Stress response also really can make us gain weight, especially in our belly fat. So that stress response is our insulin goes up. So as we get stressed, our body is like, I better store food because there might not be any later. That's our stress response. It comes from way back when not having enough food was our biggest body worry. So when we're stressed, our body releases more insulin because, again, we want to store fat for later. So it's going to put it into Siberia so we don't ever get it out. It's there just in case. So again, the more stressed we are. I remember recently I had a patient who's training for a marathon. She is working full time. She has 3 kids, a busy husband, training for a marathon, and she's gaining weight. And she's like, I just don't get it. I'm like, where are you gaining weight? She's like, in my belly. I'm like, well, you're not sleeping. you're stressed out, if nothing else, just from your life, and now you're training for a marathon. So your body is under big time duress. And that duress is making you have a bigger insulin response. So even though you're eating fairly well, what happens is the minute you eat something, your body says, I got that. I'm storing that away in belly fat. And so your muscles aren't getting the sugar, the carbs that you need. So you don't have energy for running. Your brain isn't getting it. It's just going straight to belly fat. So again, I love talking about that because then those are the tricks. We got to sleep. We have to manage our stress with meditation and being smart and maybe saying no to some things sometimes, but it's adding complex carbs and getting rid of the sugar. So how to lower your risk for heart disease. So one thing we talk a lot about at True is how do we organize this? It's with the seeds. The seeds are the 7 essential elements of daily success. So everything starts with the seeds. You've got to drink your water for energy, get your sleep, complex carbs, make sure that you're getting enough healthy protein, exercise that includes not only aerobic exercise for your cardiovascular system, but also to increase your muscle mass. And you'll see the link in our Facebook page for the seeds. You can go to our website and download a free seeds ebook that you can read about those seeds in detail. And a lot of women have even printed it off and put it on their refrigerator or put it on their bathroom mirror as that daily reminder. Also at True, we've got symptom circles. So symptom circles talk about the symptoms of midlife and menopause, but then on the back, we've got the seeds. So it's just another good reminder that we have that it's all about going back to the basics. We can talk about medications. Some women with prediabetes or diabetes will need medications to help the blood sugar and insulin resistance to give them a chance to get back. Some women with high cholesterol, especially high cholesterol in their family, will need, let's say, a statin to help reduce the risk of a heart attack by helping to lower that bad cholesterol. But everything goes back to the seeds. So it's so important to think about that. Also, there's a lot of power in a plant-based diet. A cardiologist friend of mine, I love how he compares that a plant-based diet works way faster than a statin. So again, a statin is a medication we can take to reduce the risk of a heart attack. And for some people, oh my gosh, a statin is the best gift ever. Years ago, there weren't statins and people had heart attacks that we could have prevented. So for some women, it's not about whether or not to take a statin, it's you get to take a statin. But again, a plant-based diet can be really helpful in reducing inflammation, getting rid of those inflammatory fats that are, let's say, in red meat, those saturated fats, for example, in butter. And getting away from those saturated fats and lowering the fat content in your diet can make a big difference. So I'm excited today. This afternoon, I made a butternut squash black bean chili. I don't miss meat eating this plant-based diet. One of my favorite movies about this is called Game Changers. It's on Netflix. The only thing I don't agree with the movie is that they talk about fish maybe not being optimal. I eat a ton of fish and I disagree with that reference, but the movie Game Changers can be really important, to help understand what is a plant-based diet. And the movie is all about elite athletes who are plant-based and are strong and very, very successful in their sports. So again, it's thinking about that healthy plant-based diet. So, and again, eating a plant-based diet does not have to taste bad. The chili that I made tonight is amazing. So there's a lot of great cookbooks. There's a lot of great recipes we talk about at True. And so it's really important to know what you can do and to still enjoy life and allow that healthy lifestyle to have you keep doing what you want to do as long as you want to do it and when and how you want to do it. And avoid the belly fat and the chin hairs. So I see that we're already moving toward 30 minutes. So what I want to get to are the 5 tips. And I really want this to be something that can help organize your thinking around this. So there's lots of information, but let's just sum it up in 5 tips. Tip number 1 is I want you to make a clear intention. Think of it as a trip. If you don't have a destination, then it's hard to know where you're going. It's hard to plan. It's hard to get there. So I want you to be really clear about your intention. What is your picture of self? Thanks, Amy. So it's to be really clear with how do you want to be at a specific event. So a lot of people will talk about how they want to be, let's say, when their kid graduates from high school, from college? How do they want to be at a family wedding, at a family event, especially when we can all get together again? How do they want to be at their 50th birthday, their 55th? And again, to make that intention clear, because I think there's so much power in having a clear vision of where you want to go and thinking about the importance and the value of that moment in time. And the more clear we are, again, it can power us through. People will talk about motivation. They'll say, well, I don't have motivation to exercise. I'm like, that's just frosting on the cake. Some days I don't have motivation either, but I do it because of that vision. I would say to people, do you brush your teeth? Well, yeah. You brush your teeth because you don't want to have bad breath and you want to have shiny teeth and you don't want to have cavities, right? So do you feel like brushing your teeth? Well, not really, but you do it anyways. Yep. So it's not about motivation. This is about choices moving toward that vision. So tip number 2, I want you to know your family history. Your family history is so important in terms of helping you predict your risk and knowing what you want to do. Now, some people will come in and say, it's so sad. My mom had a heart attack. I don't want to have a heart attack like my mom. So I value that. That's a very clear image, but then I want to flip it to the positive. So I want to live a healthy life that my mom didn't get to live, but I want to live a healthy life. I want to be active with my kids. Again, so it's knowing your family history, but again, how can we flip it to the positive and use it to power us going forward? And one thing we talk about is our PIP, or place in process. So in the book that describes what we do at True, I Want to Age Like That, is talks about your picture of self, and we really work hard to help you process through that picture of self. And what does that mean in terms of, let's say, heart disease or diabetes or obesity risk? So, but then we help calculate your place in process, or your PIP. So in the book and in the accompanying workbook, it helps you walk through these things. And again, knowing your family history, when you start to read the book or do the workbook, you can use that to calculate your place in process. Your place in process is where you are now compared to where you want to be. And actually what we do is we have what's called a life map. So we use that to chart out where do you want to be versus where are you now. And so I'll have a patient who says, well, I want to be, and we score it actually, I want to be a 27. I want to be low risk in all categories. I want to be rocking it. Then we calculate her score, and she's not a 27, she's a 21. And so I'm like, okay, cool. So you can lower your goal and we can kind of keep you where you're at, or you can up your game. And I know we can get you up higher than you are now. So again, knowing your family history is one of those factors that's really important. So I'm adopted, and so I know some of my family history. Hey, Sister Allie, if you're out there. So I know half of my family history. I don't know the other half. And so again, I'm going to be a lot more aggressive about trying to figure out where I am now, because I don't get to know as much of my family history as some of you out there. So tip number 3, I want you to know your A1C. What is A1C? A1C is a measurement of your average blood sugar over the last 3 months. So it's actually reported out as a percentage, and it looks at how many of your red blood cells have sugar stuck to them. So it's a very convenient tool to look at your average blood sugar. So you might have a fasting blood sugar of 105. So I don't maybe know how serious to take that, but we look at your A1C over, and again, it looks at your blood sugar over 3 months. So it gives us more indication of your risk for, let's say, heart disease or stroke or dementia. Now, A1C can be high even if you don't have, or you're not aware of much of a family history. Recently, I had a patient who is very atypical that she has prediabetes. She's very thin. She doesn't have a strong family history of diabetes. We really had to kind of look back on both sides of her family to figure that out. There's some, but certainly not very strong. But for some reason, maybe she inherited one recessive gene from one side and one recessive gene from the other, but at a very thin weight, which is not typical for prediabetes, she has prediabetes. And so the fact that we know that, we can do all sorts of things. And just by her adding complex carbs to her diet and getting rid of some of the simple, her family was doing a very plant-based diet, but like no brown rice. It was all like protein and vegetables, which of course is great, but she needed to add complex carbs. And the fact that she's added complex carbs, she has increased her muscle mass, she's dropped her body fat, dropped her visceral fat, and her A1C is coming down. So A1C is something that we routinely check at True. If you choose to join True and see us directly, we'll order those blood tests before you even come to True, and we can start to look at that at your very first visit. So I want you to know your A1C. It's super important to know, even if you don't appear to be the typical patient with diabetes. Now, obesity does come before prediabetes and diabetes in most of the time, but not always, as that patient reminded me. And people remind me of this over and over. So number 4, I want you to see if you can limit to only one simple carb or treat per day, and then track it. At True, we offer our patients an app that allows you to track. Laura, call me later. I know you're A1C. So, it's you have one simple carb, but you've got to track it on, whatever tool. So again, we offer our patients an app that they can track their seeds. Again, if you download the seeds ebook, you can actually look at your seeds, and you can see what you're doing in terms of simple carbs. So on the app, we ask our patients, did you limit your simple carbs to one treat per day? So again, to track that. And what's really fun is as you bring that amount of simple carbs down, you won't crave it as much. You'll start to lose a little belly fat. You'll lose some of your insulin resistance, and you'll just feel so much better. So tip number 5, I want you to add complex carbs to your diet. So again, whatever that is, you can reference the book Sugar Busters. At True, again, we offer our patients lots of options for complex carbs. And if needed, get a nutrition coach who knows about glycemic index. At True, we have Anna. I love her. She's got a degree in nutrition. She's a Culinary Institute trained chef. She's in training to get her registered dietitian master's degree. I'm so proud to have her on our team because she can really help our patients figure out what they want in terms of what kinds of food they're used to eating, if they have any cultural desires for certain foods other than some more than others. If they, I worry, for example, if a woman has insulin resistance, many women of Asian descent tend to have more insulin resistance. And again, if their diet is stronger against stereotyping, but often true, let's say in white rice, that's not good, and that really increases the risk. One thing I've learned that, for example, in the country India, 1 in 3 women have diabetes over the age of 55. 1 in 3 women. So if the diet is a white flour naan bread, if it's white rice, it really does increase the risk of diabetes, especially because insulin resistance is so strong in the genetics. So again, it's adding complex carbs to your diet. And again, too, on True, we've got lots of good recipes, and Anna, again, is our nutrition coach. But it's important to know this, the sooner the better. The next thing I want to do is talk about 5 things I want you to ask your healthcare provider. If you don't get to come and see us at True, then I want you to ask your health provider these things and know these about your health. Tip number 1 is what is my risk of heart disease? So that's something that any healthcare provider you see should be able to calculate using a Reynolds score, using an ASCVD, but looking at all those factors and putting that together. That's something I believe should be just standard care. I think that everyone should know their risk of all these areas of wellness, but especially heart disease, because it steals too many women of quality years of life. So again, ask your healthcare provider, what is my risk of heart disease? Question number 2, what is my phase of ovarian aging? Why should we care about that? Number 1, menopause isn't that much fun necessarily, so it's good to know where you're at. If you've had a hysterectomy, we can still figure it out with your symptoms and maybe with a blood test. But what happens is that as a woman goes through menopause and as her estrogen drops, she becomes more insulin resistant. And so we know that women after menopause have a bigger risk of belly fat. We call it the menopause. So that belly fat then, of course, as you know now, increases the risk of heart disease. So if you know that's coming, I love it when patients come to see us let's say in their early to mid 40s before those changes start to happen, so we can be ready for it. At menopause, unfortunately, for many women, your health is as good as it's going to get. I don't mean to be Debbie Downer, but menopause is a really important risk factor for risk of heart disease, stroke, and dementia. And what you do at midlife, your blood pressure, your belly fat, your cholesterol, your blood sugar, what you do at midlife predicts how you're going to be at 80. 70 doesn't predict 80, 50 predicts 80. So what we do now has everything to do with how we're going to be on our later side of life. Okay, question number 3. If my risk is elevated, why is it elevated? Is it my cholesterol? Is it my weight? Is it my activity? Is it my diet? What is it? And then it's for you then to use that to think about, okay, what's keeping me from exercising? What's keeping me from eating a healthy diet? Is it knowledge? It shouldn't be money in the sense of eating healthy complex carbs is not expensive. Sweet potatoes are not expensive. Brown rice is not expensive. So there are simple ways that are not expensive to make these very healthy, heart healthy foods. So again, it's knowing if your risk is elevated, why is it? And then what can I do about it? Question number 4 is, how does hormone replacement therapy affect my risk for heart disease? Am I a candidate for hormone replacement therapy? We know that hormone replacement therapy actually can be very beneficial to reduce a woman's risk of heart attack, stroke, and dementia if it started at the right time. So we know from several studies that if it started in the first 6 years of menopause, that means in the first 6 years after that last period, or when those ovaries are removed for whatever reason, in the first 6 years, it's critical that estrogen be started if it's okay for you and if that's what you want to do. But in that first 6 years, it can reduce the risk of calcium developing in the blood vessels around your heart, and it can reduce the risk of thickness in the wall of the carotid artery. So hormone replacement therapy is way safer than most people think. But let's say you wait too long. You don't come in to see a healthcare provider who knows about estrogen until 10 years past menopause. We worry that you might have missed your window. By 10 years out from menopause, you might already have so much plaque built up that hormones wouldn't be safe because potentially it could increase the risk of heart disease. So if I see a woman at 9 years out, estrogen might not reduce her risk, but it likely would not cause harm. And potentially it could still have many health benefits and help her feel better. So it's one of those things that we have to be really careful. We've got to know our business. So I would recommend you see a certified menopause practitioner, an NCMP, a certified menopause practitioner by the North American Menopause Society, again, to understand that you're getting the right options for treatment. And you can find a certified menopause practitioner in your area by going to menopause.org and looking for a practitioner in your area if you're listening to me outside of Michigan. And the last question I want you to ask your healthcare provider, have I had the right tests? So for example, one of the tests is an A1C. Another test is a lipid profile. But one test that sometimes we'll order for patients is called a CAC, coronary artery calcification. So it's a score that often insurance doesn't pay for screening. Insurance will pay for it if you've already had a heart attack, and we don't want to get there. But for some women who, let's say, have high cholesterol and we really aren't sure if we should be aggressive, let's say, about a medication, then sometimes a CAC will be really important. I've had patients who have had the test done who really only had a couple risk factors, but they already were developing calcium around their heart. So number one, it was a wake-up call for them to say, wow, this is serious stuff. Like, I really need to get on this because I am already developing risk for plaque in the blood vessels around my heart. For some people, it's a decision maker to say, yes, I'm going to be really aggressive about that plant-based diet, or, yeah, I guess it's time to start a statin. For some patients who then we discover have that calcium in the blood vessels, we refer to cardiology, they get a stress test, and it really helps make us all feel secure that we're doing everything we can to keep them healthy and safe. So again, ask if you've had the necessary tests to understand your risk. So I want to see, or do we have any questions? Lots of great information. Lynn says, well, I want to be able to get down on the floor and play with my grandkids. Yes, and get back up. So very critical, Lynn. So again, yes, it's having those clear goals. And what I want you to think about is this Sunday, it is Valentine's Day. And I would love you to show yourself and your heart some love and join True Women's Health. When we see you, we wrap around you and do a deep dive into what do you want, where are you headed, and what are your risks, and how can we help support you in getting what you want. So we are a membership-based practice. We don't participate with insurance in the traditional model, but there are many ways to make whatever your plan is work for service at True Women's Health. So we offer these wellness programs, our complete wellness program, our basic wellness program, and our cancer wellness program. We also offer visits for women 25 and under called the Empower Program, and for women 65 and over called the Silver Wellness. We love what we do at True. We would love to see you walk in our door at our beautiful office and again, circle around you and help support you in your goals. So thank you for listening. I wish you stay safe, be well, and be kind to your heart. Thank you.